Welcome to ASWB LCSW exam practice test. Our topic today is psychotherapy, clinical interventions, and case management. Use the link in the description to download the app on the App Store for free practice tests. Number 1. In geriatric social work, assessment is not concerned with which of the following? A. Home safety. B. Work safety. C. ADLs. D. IADLs. The correct answer is B. Work safety. Explanation. In geriatric social work, assessment is concerned with presenting problem and client's resources for resolving it, intergenerational dynamics resources, relevance and impact of family history on present functioning when adult children involved, presence and effect of chronic illness and physical cognitive limitations, home safety, medications, their influence on functioning, and negative side effects, need for supportive services or institutional care, ADLs, activities of daily living, for example, bathing, dressing, etc., and IADLs, instrumental activities of daily living, for example, cooking, driving. Number 2. In terms of the Freudian or Neo-Freudian approach to group practice, how many members does a group have? A. 4 to 6 members. B. 6 to 8 members. C. 8 to 10 members. D. 10 to 12 members. The correct answer is C. 8 to 10 members. Explanation. The Freudian or Neo-Freudian approach to group practice is described below. Groups of 8 to 10 members. Interaction mainly through discussion. Group members explore feelings and behavior and interpret unconscious processes. The worker uses interpretation, dream analysis, free association, transference relations, and working through. This approach aims to help group members re-experience early family relationships, uncover deep-rooted feelings, and gain insight into the origins of faulty psychological development. Number 3. Which of the following stages consists of clarification of differential and cohesive processes, group autonomy? A. Separation stage. B. Intimacy stage. C. Differentiation stage. D. Power and control stage. The correct answer is C. Differentiation stage. Explanation. The intervention and development stages of the worker in work with groups are: power and control stage. Consists of limit setting, clarification, use of the program. Intimacy stage. Consists of handling transference, rivalries, degree of uncovering. Differentiation stages. Consist of clarification of differential and cohesive processes, group autonomy. Separation. Consists of a focus on evaluation, handling ambivalence, and incorporating new resources. Number 4. Which group member's method of forestalling or dealing with termination states that reaction can be simple to complex? A. Evaluation. B. Regression. C. Simple denial. D. Nihilistic flight. The correct answer is B. Regression. Explanation. Regression is one of the group members' methods of forestalling or dealing with termination. The method states that reaction can be simple to complex. Earlier responses reemerge, outbursts of anger, recurrence of previous conflicts, fantasies of wanting to begin again, attempts to coerce the leader to remain, etc. Number 5. Which of the following is not the stress that a worker might experience in the beginning phases of a group's process? A. Financial difficulty. B. Difficulty in observing and relating to multiple interactions. C. Uncertainty about the worker's own role. D. Anxiety regarding gaining acceptance by the group. The correct answer is A. Financial difficulty. Explanation. The stress that the worker might experience in beginning phases of a group's process includes anxiety regarding gaining acceptance by the group, integrating group self-determination with an active leadership role, fear of creating dependency and self-consciousness in group members which would deter spontaneity, difficulty observing and relating to multiple interactions, uncertainty about the worker's own role. Number 6. What are parent education groups labeled as? A. Spiritual groups. B. Orientation groups. C. Psycho-ed groups. D. Relapse prevention groups. The correct answer is C. Psycho-ed groups. Explanation. Parent education groups are used in social agencies, hospitals and clinics, often labeled as psycho-ed groups or parent training groups. Use a cognitive behavioral approach to improve the parent-child relationship. Often structured to follow manuals or curricula. Focus is helping parents improve parent-child interactions, parent attitudes, and child behaviors. Number 7. Which of the following approaches focuses on life transitions, environmental pressures, and maladaptation between individual and family, environment? A. Ecological or life model. B. Crisis intervention. C. Family therapy. D. Task-centered approach. The correct answer is A. Ecological or life model. Explanation. The ecological or life model focuses on life transitions, environmental pressures, and maladaptation between individual and family or environment. This approach also focuses on interaction and interdependence of people and environments. Number 8. Which is the second phase of treatment in the psychosocial approach? A. Termination. B. Ongoing treatment or interventions. C. Engagement or assessment. D. Contracting or goal setting. The correct answer is D. Contracting or goal setting. Explanation. The phases of treatment in the psychosocial approach are 1. Engagement or assessment, applicant becomes client, increasing motivation, initial resistance, establishing work relationship, assessment, informed consent tree, confidentiality, client or worker's roles, rights, responsibilities. 2. Contracting or goal setting, client or worker's mutual understanding goals, treatment process, nature of relationship or roles, intended time of treatment. 3. Ongoing treatment or interventions, working toward improving previously agreed upon problems, major focus, current functioning, conscious experience, dealing with ongoing resistance, transference, countertransference. 4. Termination, potential for growth, reiterate major themes of treatment, experience feelings about relationship ending. Number 9. Which is not the motivation for change in the behavioral modification approach? A. Disequilibrium. B. Anxiety. C. A supportive relationship. D. Conscious desire. The correct answer is C. A supportive relationship. Explanation. The behavioral modification approach sees the following as the motivations for change: disequilibrium, anxiety, conscious desire to eliminate a symptom, agreement to follow a behavior modification program. Number 10. Which of the following type of groups helps members learn social skills and socially accepted behaviors and helps members function more effectively in the community? A. Therapy groups. B. Socialization groups. C. Growth groups. D. Educational groups. The correct answer is B. Socialization groups. Explanation. The different types of social work groups are 1. Educational groups, which focus on helping members learn new information and skills. 2. Growth groups, which provide opportunities for members to develop deeper awareness of their own thoughts, feelings, and behavior as well as develop their individual potentialities. 3. Therapy groups, which are designed to help members change their behavior by learning to cope and improve personal problems and to deal with physical, psychological, or social trauma. 4. Socialization groups, which help members learn social skills and socially accepted behaviors and help members function more effectively in the community. 5. Task groups, which are formed to meet organizational, client, and community needs and functions. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.